7:15 meeting to order. The agenda has been modified a slight bit, just as of a few minutes ago, to keep the order flowing so that DHS is all reporting at the same time. So if you commissioners may need to refresh your screens in order to make that modification. The agenda is in front of you. I'm looking for a motion to accept the agenda as printed. A motion and support. All in favor say aye. Opposed the same. Motion accepted. Public comment. We would be more than happy to hear from any public members for up to 5 minutes to address the board. Is there any public comment? Seeing none, there is the opportunity at the end of the meeting also. Under committee items, our first item are the meeting minutes of February 9th. We have a motion and support to accept the meeting minutes of February 9th as printed. All in favor say aye. Aye. Opposed the same. Meeting minutes accepted. Lifeways monthly report. Mary Beth.
Good morning, Commissioners. Okay, in your packet, you'll have my monthly report, and I wanted to touch on a few things that are not in the packet because of the timing related to the submission of the report to the county. First is in regards to the SAMHSA grant that Lifeways is partnering with the Center for Family Health and Allegiance related to applying for a SAMHSA grant, potentially $1.4 million over a 4-year period that would allow us to do additional work related to integrated health and the partnership around wellness with Allegiance. So we're really excited about that, are hopeful that we would be able to receive that grant. We just submitted it last week. So the other thing that I'd send you a packet, just a brief discussion about, is around capital improvements. As you know, there's some needed capital repairs for Lifeways building here in Jackson, as well as some of our group homes. And we are in the process of having discussions with the county in regards to a potential bond, and also looking at working with Rick Sheely on the estimates for what those costs will be. So we will be working on pulling that together to present to Mike. The other thing that I wanted to update you on that's in your packet is related to Mid-State Health Network. As you know, we're part of that regional entity, and just to kind of always keep you appraised as to what's happening at a regional level. Being a part of this regional entity, we have seen the benefits locally as a community mental health because of the fact that we were one of the lowest funded community mental health of the 12 in the region. So we saw an increase in Medicaid funding for Jackson and Hillsdale County. And that's a positive thing because it has allowed us to be able to expand respite services as well as be able to implement the intensive crisis stabilization service in December. Our first quarter report will be presented next month, so you'll get to see some of the outcomes of the 90 days of implementation of that new program. The other thing that I wanted to mention was related to the supplemental. As you know, we had experienced a 70% reduction in our GF last year, and there was a lot of advocacy done at the state level to talk about the fact that there were still populations of people that would not be eligible under Healthy Michigan expansion, and that there was still a need in the community mental health to have additional GF. They did pass a supplemental bill that put an additional $20 million back into the GF side of the community mental health. That is in for this fiscal year and also for 2016. The other thing was that recently the department released some of their focus for this next fiscal year, and what's important as it relates to service delivery at a local level is that they are looking at capacity concerns that the community mental health are experiencing with specific populations for children in need of state inpatient and specialized residential. So they're going to have some focus on creating services around the needs for children, as well as looking at, and I've mentioned this here before, the fact that we've been struggling related to, and it isn't just Jackson and Hillsdale County, it's statewide, about local psychiatric inpatient needs and the fact that there is a capacity issue statewide. So they are gathering that data from across the state and looking at potential options to address those capacity concerns. So we look forward to hearing what the department is going to do in that relation, because we are challenged with that here locally, and at times we have individuals in our ER up to 5 days waiting to find a placement. So that's important. The other thing that was also recently, and I think we mentioned this, both myself and Zoe last month, related to the executive order for the merger of Department of Community Health and the Department of Human Services. That is to go into effect April 10th. What we do know at this point in time is related to the fact that they're going to be creating and combining children's services and aging into specific departments. Other than that, there's not a lot that we know at this point in time. I do see, from a community mental health perspective, the benefits of being able to actually do that. I see where we'll be able to improve care coordination, be able to improve access to entitlements that people are eligible for. So that's going to be a good thing. But the actual details about what that will look like, it's probably more at a higher administrative level. Locally, they're indicating it's not going to change anything related to service delivery. Those accessing services are not going to see a change. The other thing that I wanted to appraise you about is in relation to a change that's occurring that aligns with our strategic planning at Lifeways. Part of our strategic planning is to look at our business model, and I think I shared that with you in January, about the fact that we're ensuring that our business model aligns us for the future. And the future is about care coordination and being able to manage the care for those high-risk populations. Recently, we've had some concerns about a specific service called HAB waiver. So it's a service that's provided for individuals with developmental disabilities who would otherwise, without this service, be in a state institution. We've been concerned about the quality of the current care management that we contract out. We are taking that back. And we provided communication to the stakeholders on Friday of this last week. The implementation timeline is for July 1st, where that will be managed through the community mental health, and we will no longer contract that out. And the biggest reason is for risk management. This is a high-cost, high-risk population that we need to ensure that the care is delivered and the people that are most vulnerable are protected. So that's an update. You might hear about that. When we presented it to the stakeholders that are involved, a lot of them understood. And when you look at the models that are within our region, we are the only community mental health that was not managing that population directly. So that aligns us as a region as well. The other thing that I wanted to touch on briefly was related to the expansion for mental health first aid. I've talked about that here. We're partnering with the ISD related to moving mental health first aid with the youth in our schools across over a 4-year period, training everybody from, person working in the cafeteria to the bus drivers around mental health first aid. And that's going to be a positive thing for our community, and we're really looking forward to the outcomes of that. And then the last thing is related to our crisis response team. We have a community crisis response team that we've been able to train 35 individuals in our community around being able to have an actual, right now, when a community need occurs and there's a crisis, they contact Lifeways, and we do provide staff that go out and address those emergency needs of, it could be a death, a tragedy like the incident that happened at the YMCA recently where they lost a staff person that was very loved. This is an ability for us to look at partnering with our community and having other individuals in the community across the school system and law enforcement who are a part of that team. So this is a good thing, expanding the makeup. But wanted you to be aware of the fact that we're moving that along as well. And that is it for my update.
What comments or questions might you have for Mary Beth? Commissioner Shotwell?
Mary Beth, if you're moving away from the contracted services model to full-time employees for your mental health program,
Yep.
are you being cognizant of the liabilities that come with those staff people when it comes to benefits outside of just pay? That was
Yes.
the big advantage of being contracted services, was that we didn't have the long-term legacy expenses.
That is correct. I mean, one of the things that you have to weigh is the risks associated with the current arrangement where we're contracting it out. We're not taking back all of the types of services that are care managed. The risk associated with this population is significant, and the need for our organization to truly manage that care and reduce the risk is, I mean, that's the reason why we're going in that direction, and you kind of have to weigh the costs associated with the risk for this, and that is what we have done.
On the other side of that, in dealing with the mentally impaired, and forgive my
That's okay.
my language, those people become cognizant and used to a certain social worker, and disruption of services when it changes persons can be very difficult for them. Will these employees that are going to eventually be either laid off or removed from these other jobs have opportunity to become employed then by Lifeways, or will Lifeways be looking just at complete new hires?
No, they were absolutely, when we had a discussion with the stakeholders involved, informed them that they all have an opportunity to apply. And when you refer to the challenge related to continuity of care with the change related to case managers or supports coordinators in this case, one of the things that was brought up in one of the stakeholder forums, and this was individuals whose their consumers and guardians indicated that they hope that this will create more stability because of the fact that they have had, a changeover every other couple of months. So I think that this potentially is going to actually improve that issue. But they do have an opportunity to apply. Yep.
Seeing no other comments or questions, thank you, Mary Beth.
Yep, thank you.
Next on the agenda, we have MSU Extension Semi-Annual Report. I would invite Brittany James, Phil Tocco, and Carolyn Foster to the podium.
First off, I know that you guys have to do this, but we certainly appreciate the invitation. And I believe we have, is it on the desktop, Adam? Yeah.
Did you send it to us, or
We did send it to you.
just in board docs?
Yeah, but it's in board docs?
Well,
Here.
go ahead, it's
You'll know.
better off to plug it in if
Okay,
you have
let
it.
me do that, sure. Okay. Okay, there you go. Okay. Cool. Here we are. Thanks. Okay, so basically, we've got, first, has everyone met? Probably many of you know Brittany James, but Carolyn Foster's going to be introducing herself as well. Carol is a supplemental nutrition assistance program educator, and she'll be talking a little bit about some of the work that she does as well. So, but I'm kicking it off here. I'm going to talk about three things. This is not going to be a inclusive everything that we do, but this is definitely going to talk about some of the highlights, some things that we do in the county that make a difference. Three things I'm going to be talking about are Big Seed, school gardening, and then also the Jackson County Family Farm Fest. Really our goal is to really leverage community partnerships to make a huge impact, as big an impact as we can within the county, and these 3 programs really highlight that. So first off, our Project Rural Education Day is one of those things. It's in collaboration with Jackson County Farm Bureau, as well as the Conservation District and Jackson County Ag Council, and we bring over 1,300 third graders. We are not the lead in this particular program, but we work with Farm Bureau. Farm Bureau is the lead in this particular program. And we would like to invite all of you to the Jackson County Fairgrounds on April 21st. It's going to be a lot warmer than last year, I can tell you that. It's not going to be held in the end of March. If you're there at 8 a.m., we'd be happy to have you as one of the leaders to help bring around folks to each of the different stations. Our Jackson County Big Seed, last year we served 23 classrooms in 4 elementary schools. This year, this is a huge collaboration between Jackson County, the Jackson County Extension, as well as folks from St. Vincent de Paul and the folks from Together We Can Make a Difference and the Jackson County Master Gardener Association, to reach a tremendous number of people. We're in now, this year, we're going to be reaching 36 classrooms in 8 elementary schools, 3 school districts, and it should be over 1,000 students that we reach this year. The initial push in March is sort of capitalizing on March's Reading Month, going into the classrooms, reading a book about a particular kind of seed, and then this year it's a pickling cucumber. So we're reading about pickling cucumbers, and then we lead the kids in a demonstration of how to plant it. The kids then get to plant the seed and take it home with them, so it's really awesome. Then we follow that up in May with what's called the Big Seed Garden Party, and we invite community members who are looking for free seeds or free garden materials. They can come to the Big Seed, and they can get free materials, free gardens. And this sort of, one of the impacts, for those of you, I believe this is in your board packet, you can kind of read the comment there, along with the young daughter, the girl there, that was her first tomato that she grew. So this was kind of a neat experience for them. As well as doing the Big Seed, we support school gardens. We've been in 3 separate elementary schools in the Jackson Public Schools. We have gardens throughout the region. We try to help with community gardens wherever we can, as well as getting in schools and doing a 1 hour a week kind of program with them. And this is a picture of one of our interns who did the program last year. She was leading us at the Cascades Garden. And the top picture really speaks for itself. That was one of the highlights for the summer school for the girl, and she actually wrote that up. And I can't pay someone to do that, so I'm grateful that somebody did that. And then finally, Jackson County Family Farm Fest. This year it's going to be held September 19th. We're going to be at 3 sites, Sweets Dairy over on M52, Glen Seeds, and then Shrey's Club Lambs. Those will be 3 of our sites, and then we're hoping to have a 4th site real soon set up there. So that's, again, September, and it reaches anywhere between 500 and 1,000 people every year, so we hope to have a pretty good crowd there as well. If you will if I can beg your indulgence, I have seed packets for you guys if you want to have them. I'll leave them here, and you can take them later. With that, I'd like to invite to the podium Carol.
Good morning, Commissioners. I'm Carol Foster, and I'm a program instructor here in Jackson County. It's very nice to be here this morning. I will be talking to you briefly here about some of the wonderful progressions that we've made with underrepresented populations here in our county. 2 of the things that I will address today will be Eat Healthy, Be Active, which I'll refer to often as EHBA. It is our adult nutrition education program for both SNAP-Ed and FNAP. And then our Show Me Nutrition series is for youth, and that's youth from preschool up through junior high age. So as you know, we are always at MSU Extension continuously working to find more partners and just increase our partnerships and our visibility within our county. Our aim is to have stronger families nutritionally and educationally so that they can move forward and we can make a much, much better impression. Whoops. I'm a lefty, so you have to forgive me here. I do everything backwards. Bill, can you give me a hand with that to do next? There we go. There we go. Arrows, wonderful, thank you. I'm used to arrows. So, just a little bit about Eat Healthy, Be Active. Our curriculums are all evidence-based. Eat Healthy, Be Active, which you'll see in the next slide, covers the following. These are weekly, one time a week, which again I'll mention in the next slide. And these are the workshops, is what we call them, that we address every week. So we talk to our participants about eating healthy on a budget. We talk about things that they can do to change their budget or correct their budgeting so that they are not running out of, say, funds at the end of the month before their food stamps or their bridge cards are expended. Physical activity, that's something that we address as well. Tips for a healthy weight. Quick, healthy meals and snacks. Making meals a healthy part of your lifestyle. And eating healthy food that tastes great. So for example, some of the things that we do in the first workshop is, when I'm teaching in the class, I will bring 4 or 5 different seasonings. And I will bring no salt pretzels if I have a population that can eat pretzels, because we do tailor to what our population can do. So for example, if it's seniors, I may have to bring a bread or something, because there may be some issues with dentures or things of that nature. And I don't label the seasonings, but as participants come in, we have them to taste by taking the pretzel, dipping it in olive oil, and each pretzel, 4 pretzels for 4 seasonings, will go to them tasting to see if they can identify what the seasoning is. And as well, our aim is to let them know that we can decrease our use of sodium for better health. So in 2014 and 2015, the adult EHBA, Eat Healthy, Be Active, 6-week, 1-hour session, one of our participants was the faith-based underrepresented Higbee Church of God Golden Agers. This is a senior group of age 60 and above. I believe my oldest participant was 79 or maybe 83. It started in September, and we had to make a couple of adjustments only because they had a water heater or something that burst. But we did complete the program, and there were 12 participants, 9 of which I was able to graduate. That's a good number for us. The program, or one of them that I have going now that I will have to leave today to instruct, is Segway. Segway Incorporated is a community mental health organization that serves Jackson and Hillsdale County. This is a cognitively impaired group. They have been so wonderful in terms of engaging and asking questions. Some of them do have issues with reading. So in cognitively impaired groups, often we use pictures, and we always meet the client exactly where they are. And now, as well, I also have a series that starts in the evenings. It started last week. It's 5:30 to 6:30 in the evening, so we do, again, meet the client where they are, and that is also in terms of the times that they are available. So we may do some evening classes. And we only, last week, I shouldn't say only, but we're hoping for more this week, we had 1 participant, and then we had to do more advertising. Advertising is done on 211 Blast, as well as going out into the communities. And that is a partnership with the Department on Aging. So they go to their various partners that they've already established, and we go to the ones that we've established, and even more, to get our clients to come to us. So those are just a couple of the ones that we have going with the adult EHBA program. So now I just want to talk to you briefly about our Show Me Nutrition, SMN series. This is our youth series. It's an 8-week series. There's 6 lessons, and it is designed for youth with the following areas covered. It's for preschool through, again, junior high age, and the age-appropriate content focuses on nutrition, and food safety. For example, we use the Glow Germ, if you're familiar with that, to where they have simulated germs on their hands, and a black light is used so that they can see how germs are transferred very easily. Physical activity is also addressed. I will sometimes do a jumping jacks or something of that nature for part of the class session. And then we also talk about media influence. For example, many of our youths, and adults as well, but in this particular instance we're talking of youth, they have no idea that commercials are broadcast louder on television than regular programming. So those are just some of the things that we make them aware of. And then finally, which I'm very, very proud of, having just come back to Jackson County in June, I was able to secure in Jackson Public Schools Hunt Elementary. Hunt Elementary School, I was able to go into the gym, work with the gym teacher, and over 300, I believe I had 343 students from first grade to fifth grade, and they successfully completed the program. That was from October through December. And that partnership has already been secured for the upcoming school year. So very happy that that's going on. Are there any questions?
Yeah, I have a couple here, Carol.
Yes.
In regard to the EHBA program, what kind of attendance do you have? Can you give us some numbers of community people that are utilizing this program?
Absolutely. Thank you for your question. As of last week, I started with the Jackson Friendly Home, which, if you're not aware of it, it is a home for women 60 and over. I had 15 participants in that. I have the Elaine Apartments starting this week, and we're anticipating 12 to 15. So it averages generally about 15.
But you do have records of the number, if our numbers are increasing or decreasing, because this is such a voluntary program. I guess we just want to make sure that, we have an increasing amount of our population that's utilizing this. I guess that's my biggest concern,
Yes,
and that would be
and-
my question.
Very well understood, and that is our aim, and that is why we constantly go out to recruit and hope that we get better numbers and/or more organizations that will partner with
Okay.
us.
And if this board or MSUE were requesting those figures and data over a period of time, that would be available to us, correct?
Absolutely. Those numbers are put into MIPERS
All right,
on
and
a
then-
monthly basis.
Thank you. And then in regard to the JPS Hunt Elementary School, the Show Me Nutrition program, is that a service that's provided to this district at no cost to the district?
Yes, it is. And that is wonderful because they already have a lunch program in place, but because we are federally funded, we do have the opportunity to go in there and bring a snack for them as well. So we accentuate each other.
All right, thank you. What other comments or questions might you have for Carol? Commissioner Rice?
Hi, I'm over here.
There you are.
Thank you for your presentation. Very well done, very informative. I just want to make a comment. I just think it's wonderful, the partnerships that you brought up, whether it be education, aging population, mental health, all of those are very good and obviously can intertwine with one another. And I just, again, I just think it's good that you're working to put those, or continue to work to put those together and help people out in that respect. So I thank you for that. And if you want to, can you give us an idea how the jumping jacks works?
Let's see if I can do that with my boots on. We're going to try this now. And remember, I blew my knee out 2 months ago, line
Oh,
dancing.
forget about it.
Carol,
Forget
maybe
about
it's Brittany's turn to come up.
That's my excuse. Thank you so much for your time.
Thank you again, Carol.
Yeah, as the youngest in the office, I tend to get nominated for things like that, so. Good afternoon, Commissioners. I know many of you from the Fair Board, but I will, for those of you who do not know me, I'm Brittany James. I'm the 4-H Program Coordinator for the county. I'm going to talk a little bit about what we've been doing over the last year and talk about what we're looking forward to for our following year. All right, so program overview. We have In the previous year, up until January 1st, we reached a total of 3,253 youth in the county. That's through workshops, partnerships such as Project Red that Phil spoke about earlier. This is also includes our county membership, which is, it's around 470, which is an increase from last year. A 5% increase, I'm hoping for an even bigger increase in our next year. Jackson County Fair is probably one of our more visible areas in the county. Nearly 80% of our county membership brought a project to fair, whether it's an animal or a still exhibit. The Cloverbud Showmanship, we had our highest participation yet. Here's a picture of all of the youth that went through that activity. We're working on actually revamping that program right now and integrating it further into our current livestock shows to give the kids a little bit better experience. So I'm anticipating for next year our numbers are going to be probably at least 50% higher. For a large animal auction, we actually had record sales. Our number of animals that actually were brought to fair were about the same as they have been in the past, but our sales were insanely high. We're actually, Livestock Association has told me and assured me we are going to reach the $500,000 point next year. So yeah, which is absolutely amazing. It shows the support that we have in the community because the kids are going out there and they're talking to those buyers and they're getting that price per pound raised up so much. So I'm really excited about that. As far as scholarships, now we usually give out 10 scholarships, the $500 scholarships, and at the time that I wrote this, we had given out 10. We have an exceptional group of kids, and they actually, the selection committee went back to the foundation board and asked for more money because there were 2 more kids that they felt were just phenomenal. So it's really hard when we get those scholarship applications to sort out because our kids are absolutely amazing. So we ended up actually giving out 12 of those this year. The Key Club, that's the highest mark that you can get. It's the highest award for a county youth to get. It's calculated, the winner is determined by participation in 4-H as well as their school participation and their community outreach. We base it very highly on the amount that the kid gives back to the county program. So if they could bring an animal every year, but if they're actually teaching other kids how to show that animal or teaching them how to make a still exhibit, that's what we look for. We look for the kids who are giving back. So we had a Key Club award winner that for the first time this year we have a $1,000 scholarship for them. The foundation is also working on a scholarship opportunity for youth who are serving on councils and committees. Traditionally, Jackson County 4-H programs, the councils and committees are made up of adults, and we're trying to give the kids a stronger voice for that. So we're working through the details and securing the funding to put together a scholarship for the kids who are showing that leadership in the county. Some of our upcoming events, we have the Citizen Washington Focus trip. We are actually, the foundation is sending 4 kids to Washington for 8 days, and they will learn about government, and they'll get really involved in councils and committees there. We have the Chicago Educational Trip. This year we are sending, I think we have 6 this year, where they go and they learn about budgeting. We give them a stipend, and the kids have to split out, per day, how much they're going to spend on food, how they're going to get around. They have to navigate the city. I mean, there are chaperones, obviously, that go with them, but they try to leave it up to the kids to determine how they're getting where they need to go and learning to navigate a newer environment. Exploration Days this year, I'm actually really excited about this one. It's 3 days up on campus where the Jackson County youth can go and they live in the dorms, they eat in the dorms, they go to classes that are specially designed for 4-H youth, taught by professors, MSUE professionals, and industry professionals, like anything from vet science to glass etching. Some kids actually take a class where they rappel down the side of the Wharton Center. So there's some really cool things there. Our foundation has offered to pay for any kid that wants to go this first year who's a Jackson County 4-H member. They will pay the entire registration fee. So if you know of any kids that want to join 4-H and go to Exploration Days, it's free this year. But they still will, as they have in the past, pay 50% of any youth's registration fee that has gone in years previous to this. Cloverbud Workshops was the thing that I highlighted last year that I was kind of doing a push to get our Cloverbuds a little more active. I'd like to say that that's actually going really well. We have a Cloverbud superintendent now who coordinates almost monthly events for the youth to come to. And we actually have a a club that is getting started that will be just for clover buds. He wants to use it as an educational opportunity to get those youth a little more involved and send them into clubs with a little bit of base knowledge about the project areas. And then, of course, we have the 2015 Jackson County Fair, which I'm sure I will see most of you at. Really looking forward to that. I think we're going to have a record year. Last year was great, and I think this year's going to be any better, or even better. All right. Well, I appreciate you letting me talk about what I love to do, and we'll entertain any questions you have about MSUE or 4-H in general.
Thank you. For the sake of the board, either Brittany, if you would, or Commissioner Leitner as chair of the Fair Board, this year, the fair will be the second week in August, and that is different. My understanding is every 7 or 8 years, that is what occurs because of the calendar and Labor Day.
Yep.
Is that correct, Commissioner Leitner?
That was-
Brittany? Every
Yeah,
5
my
years or so?
understanding was
Okay.
because Labor Day is the furthest it can be on the 7th, it's usually weeks prior to Labor Day that the fair would be.
And for those that are planning ahead, I mean, we've known this for quite some time, so it's not as if the fair simply moved because they wanted to move or something changed.
Right.
It simply is following the calendar.
I made sure to put out a post on our Facebook page, and I got quite a bit of, what? Wait, I took the wrong week off.
Exactly.
So we're trying
exactly.
to get it out there.
And that has been another large piece of the conversation that's taking place right now in our community with the balanced calendar, that repeatedly comes up at those conversations as well, to make sure everyone's aware with that as that conversation, if that conversation continues, so.
The other thing on the fair calendar is probably last year, maybe 2 years ago, we do have in the minutes somewhere a calendar for the next 5-6 years of the Jackson County Fair, and it has all those dates on it as well, so I could pull that up and get it put out somewhere in public. I just have to thumb through some old information.
Brittany, one other point I just wanted to reinforce. On your PowerPoint, you shared record sales at large animal auction,
Yes.
$439,470.85. Understand that dollar amount comes from individuals and local businesses within our community that are supporting our 4-H'ers. So, I mean, those individuals and local businesses are to be commended for that generous
We do.
contribution.
We have tremendous community support on that. I'm constantly humbled by that entire auction.
It is. It's very impressive. What other comments or questions might you have for Brittany?
Brittany, not to put you on the spot.
Go for
but-
it.
But I asked the question anyways. 4-H, my kids were always involved in 4-H and everything, and we have a strong 4-H program here, but I guess my question is, it seems like 4-H generally is populated by the farm kids.
Absolutely.
What about the inner city kids? I mean, they desperately
I
need
agree.
4-H.
I
and don't-
actually, oh, go ahead, sorry.
I was going to say, they don't have the day-to-day interaction with farm and therefore understanding, so
Yeah, no,
therefore they need that
absolutely.
much more. How's our participation? Is there anything more we can do to?
For the more urban population, I think that we lack in that. We're a very traditional program comparatively to the rest of some of the more urban areas. But I think that one of the most wonderful things about this is I've been having these discussions. I kind of try to facilitate them when I'm with my councils and committees and my groups, talking about how are we reaching those kids that we don't normally reach. I'm super excited about this. It didn't work out for scheduling for the fair this year. We thought we had a date secured, but we thought about it too long, and now the event center's rented out. We're working on, my Small Animal Association is really great about this because they realize that most kids' introduction into 4-H is going to be in small animal, poultry, rabbit, dogs, and sometimes goats. So we're actually working on that. I've had that discussion with them as well as my still exhibit superintendents. What they'd like to do is in the future, starting probably in 2016, we'd like to do a 2-day event where we are putting together, the first day is actually going to be a recruitment piece to say, we plan to push out some marketing to the more urban communities, the unreached areas, and say, hey, you want to see what this is about, come check it out. We can teach you how to do this. We're actually going to be having youth, and we have youth who are really interested in this, putting up booths and teaching our unreached communities how to like how 4-H works and some of the benefits of 4-H and some of the cool experiences you can have, like exploration days. And then the second day would be for current members to develop some stronger skills in showmanship and, all of those different areas that they've previously done. But the recruitment piece I'm really excited about because I completely agree that we aren't reaching that urban community, that there's so much opportunity for 4-H, and they have to realize that it's so much more than the sows, cows, and plows model that most people associate with 4-H.
Have you contacted the Dahlem Center about your outreach?
Yes, I actually have been talking to them about doing some programming, maybe doing some workshops.
Because they've stumbled a couple times trying to start a program similar to what you're talking about.
Sure.
And I know that Rod Malloy would be very open to partnering with you with that, and if you need help coordinating with that, I'd be happy to be.
That would be wonderful,
one
thank you.
To talk to. I know I see Mr. Toko an awful lot. He can ask me what he needs, and I can
Sure.
work with what happens. I have a very close board member
Okay,
that
that would
I
be
can have
wonderful.
access to. One, two, we had the same issue with the Fair Events Center with an event I started to put on at the fairgrounds.
Sure.
And I challenge you to look at the Gumpert Building as an opportunity and a resource for you.
Absolutely, I love
For that
it.
type of thing, and it's a great building. We used it 2 years in a row, and last year, we had someone who came to one of our events, decide to have her wedding in there.
Oh, nice.
So it's a building that can be utilized, that's at the fairgrounds, the central location, the fact that it's on a bus route,
Sure.
really makes it nice for people who are in an urban environment to get to it.
Right, and I think a part of that also wasn't it was this fact that we didn't get the site, but I think the committee as a whole wanted a little more time to be more strategic and plan it. So this year, this spring, before the enrollment deadline of May 1st, they felt that they wouldn't do a good job of putting that together. So yeah, absolutely, I think that's a wonderful idea. Thank you.
Mr. Overton?
Just in follow-up, I heard a couple different programs in the past that I thought sounded intriguing. One was a community of fairgrounds was using one of their barns. They're situated much more like we are in a more of an urban core. And they were using that facility for those folks who may not have the resources, who live in the community locally. They don't live on a farm. So what do they do with this or that? Whereas they were using the fairgrounds to do some farming, literally, some
nice.
planting of this and that, and as well as some small animals. Whether that's possible, I don't know. I'm just throwing it out there.
Sure.
And then I myself used to do a 4-H class, a different one. Mine was sailing. I taught people, young kids, how to sail small sailboats.
I keep
it's
trying
a
to get you
very
to start that one here.
Different, non-traditional 4-H program. There's a lot of opportunities out there to do non-traditional 4-H, which will draw in some of the other folks.
Sounds like
I think so too. I've been trying to get him to bring his rabbit to fair, but he won't.
Commissioner Mahoney?
Yep, I just had a question.
Sure.
One of the things that we talked about at the MAVE convention was that some of the fairs are involved like urban gardening in like some of the competitions. Have you guys ever explored that?
I know that Phil does some community gardening pieces. I'm not sure that we've ever done it as a outreach to have kids bring those and join, be members, which I think is a wonderful idea. I think it would be definitely worth exploring. In fact, Phil and I have been having some lengthy discussions about potentially securing some funding to do an intern that would be able to go into those communities, less served communities, and work together with them to bring more kids into fair and show them what they can do. My rabbit and poultry superintendents actually have been looking at different codes for, having livestock and how many birds you can have in certain city limits. And all around Jackson County, they actually have it all mapped out of how many hens you can have, and they're putting together some informational pieces for recruitment. Because I think there are so many things that can be done here that still relate to where your food comes from. I think it's a great opportunity, but we have currently nothing for that, but I think it's a great idea.
All right, and finally, Commissioner Leitner, I think this is a perfect opportunity to stress what the Fair Board is doing to show their support to 4-H and those who bring exhibits into the fair. Could you explain to us what happens with the money that's raised from the Beer Fest this Saturday, please?
All the proceeds for Beer Fest, which is Saturday, $25, in advance are the tickets, $35 at the door. It's noon to 5, so I'll put that little plug in there. But all the money that's raised from Beer Fest goes to the premiums for the fair account, which goes for all the exhibits and for the fair. So it's not just something that goes into general fund and just fund money and beer money. Actually, the beer money goes for a good cause, so that is for all of our kids for exhibits.
If I could say something really quick, I know as a 4-H staff person, I'm greatly appreciative of the relationship that we have with the Fair Board and Denise, and it's been a wonderful partnership. I'm really looking forward to expanding that and pushing it into uncharted territory, so.
Great, thank you. That was a great conversation, Brittany. I tell you, I can't remember the last time someone stimulated us for so much conversation here. Thank you for all that information.
Oh, thank you. And if you have any
That was Huey.
questions, let me know.
Thank you.
I'm always available. Thank you.
Next on the agenda, we have Medical Care Facility Quarterly Report.
Good afternoon, everyone, and I am sorry to say that I won't be nearly as stimulating. I'll try. Okay, I just wanted to let you all know our audit is finished for this year. We got a very good report, verbal report back on exit from the audit that we'd done a good job, and there were no major issues. We are beginning to cost report plan, and the cost reporting needs to be done by May 31st. We're document gathering at this point and getting ready for that team to come in. Our AR days out are at 52, which is acceptable. We want to improve that, but it's not bad for our business at all. Census at JCMCF is above budget at this rating, and today I checked and we are at 97.4% occupancy, which is really good. Our final draft of our budget was presented to the board in February and approved. Our budget factors in the GASB rule changes and calls for an increase in bad debt because of those rule changes and an increase in OPEB expense. Our year-end financials are not completed yet. There's only one line item out, and we're working with the county to get that squared away. That should be done very shortly. All financials, bank statements, AP processing, AR, and all other financial issues and concerns have been reviewed and appropriately acted upon. Our bond refinance is coming up, I believe, this month, and I've answered all the questions for the attorneys that they had for me, and I met with Mr. Salmon last week very briefly. He showed me two different possibilities, and Mr. Markowski is reviewing that, and we'll share that with the board, and they'll make a decision very quickly on which way we're going to go. We monitor our readmission rates pretty much weekly. We take a check at them, sometimes daily. I did a look-back review for the last 3 months, and our rates were at 6.33%, which is all of our Medicare A rehab type residents. If they have to return back to the hospital within the first 30 days, our rate should be below 16%. So we have well surpassed what is expected of us. And census has been high enough, consistently enough, that we can bill for bed holds, which we haven't been in that position in 2 years, so this is really good. Under the people pillar, our M&A contract negotiations, we did receive the request just at the end of last week. Residents voiced no recent concerns of consequence at the last resident council meeting, and everything that they had as a concern was immediately addressed. Our morale improvement team continues and has now widened its scope to the development of a person-directed culture in our home, and they renamed themselves because it really isn't about morale anymore, it's more about building our future. And that core team is what they call themselves now, creating an optimistic and respectful environment. The contract-driven overtime mandation issue that we had trouble with last year has been resolved through a contract change that was spearheaded by work with the union stewards themselves. So that has been changed for the CNA contract, and our mandated time is dramatically decreased, and everybody's happy. All resident, care partner, and visitor incidents were reviewed by myself. Trends and patterns of any concern at all, which we didn't really have but one. were addressed as needed and reported to the safety committee, and that trend and pattern was resident falls. What we found it to be was an increase in falls that directly correlated with increase in the number of new admissions, and that happens more often during that first 2-week period. I met with all new care partners in orientation, and I continue to work with the regional and county emergency planning groups. We actually have a team that works with them. I personally am working on the continuity of operations plan, both for our audit and for the emergency plan. We had one arbitration that has been settled equitably. We have no arbitrations pending. We have no grievances pending either at this point. We continue to use Facebook to do our anniversary honorings for people who have worked any length of time at our building. We honor them on Facebook with just a nice recognition piece. We were instrumental in assisting residents from a home that closed in Albion. It was a Magnum skilled nursing facility, closed. And we probably took close to 10 residents from that home to house them. And they're mostly people that were Marcia Smiths from Guardianship, and she interviewed them after they'd been with us for about 2 weeks and informed her that this was the best home they had ever had. So we were very proud of that. And we also, the state ombudsman went out of her way to call me and thank me for being able to assist in that process. It's very traumatic for people when their home closes, beyond traumatic. And so we tried our very best to make it as smooth a transition as possible. My director of nursing and myself are honored to speak at this year's joint provider surveyor session, which is about 1,000 people who provide nursing home care and the surveyors who do the surveys. We've been asked to speak on relational staffing, which is the kind of staffing that we do, and we are very honored to do that. It also gives our home a very good reputation in the state. I also attended the MCMCFC Region 3 meeting for survey updates and networking. Quality, policy and procedure team met, incidents were reviewed. We are currently free of any survey issues, but our survey window is open, and we have been working extremely hard to prepare. We never know when they're going to come. In nursing homes, they don't announce, they just arrive. And they can arrive either 3 months before or 3 months after your last annual survey, so we never really know. So we get ready early. We continually review our quality statistics, comparing them to both state and national outcomes and our fellow MCF facilities. We have some very strong positive quality measures. They include our percentage of antipsychotic medications used. We are well below the federal and below the state. We have 0 acquired pressure ulcers, which for a building of our size and acuity is also very, very good. We have a turnover rate that runs about 18% and very low on our hospital readmissions.
Sandy, would you please explain to the commissioners 0 acquired pressure ulcers?
Sure.
The acquired word there.
A resident may come to us from an alternate setting, be it hospital, home, assisted living, wherever, and they may have a pressure ulcer from that setting. When we grow them ourselves, when they're developed within our facility, that's an acquired. The others are considered NFAs, non-facility acquired. They're weighted more heavily if you have a facility-acquired pressure ulcer when your quality measures are done when you turn in your MDS assessments. I hope that makes sense.
What's your ability to close non-facility acquired ulcers?
Very good and very fast. We use whatever treatment or equipment that we need to do to get that done. We have expertise in wound vacs. We do make trips to the hyperbaric chamber if the resident needs it for, that Allegiance has. That's worked out very well for us. We have a wound physician, and we have a wound team. So we heal it very quickly. Okay, they can ask me what they are later. we are working very closely with Allegiance Health to provide a seamless transition of care, even for the highest of acuity residents. We've met with the hospice department, emergency room, nurses and managers, case management, and the chief nursing executive to examine any and all areas that we can do to improve that transition process. I am again proud to say that the medical directorship stayed with us, and we do still have our residency program through the senior resources at Allegiance. We did successfully re-register with the Eden Alternative also for this year.
And Eden Alternative is?
It's our form of person-directed care. It puts the elder who lives in our facility at the center of our world in their own decision-making. I guess that's the synopsis. Almost all of our open positions have been filled, and we have worked very, very closely with our therapy team to ensure that we're capturing the best that we can in all of our reimbursement coding, which is very, very, very involved. And our CNAs, our direct line people, have been trained right along with everyone in the whole process to ensure we capture the best that we can. We are also working on that Eden recognition at Milestone 3, which is the next level of recognition, and there's only 4 of them. So we're pretty proud.
Excellent. What comments or questions might you have for Sandy?
How many beds does the current medical care facility house?
194.
Thank you.
Welcome. Anything else?
Seeing no other comments or questions, thank you. Next on the agenda, we have Zoe Lyons, and I see Edwin Payne here also. Are you just back up, Edwin?
Yes, I am.
Okay, good. And just for clarification, following both the medical care report we just received and DHS report, I will give the DHS board chair the opportunity to speak if he has something to add to these reports. Thank you. Hello, Ms. Zoe.
Hello. Edwin may not want to come with me because as we listen to MSU Extension and I have my community resource coordinator, I'm going, do we have them here in my office and do we have their stuff? And so he's got all kinds of work to do now that he's been here with me. But he does say, yes, we have MSU Extension stuff in our office, and he's setting up meetings, so. Good afternoon. Thanks for having me here. As Mary Beth was talking, I was sort of crossing some of the stuff off my report that she's already mentioned. So my report sort of started with the merger of Department of Community Health and Department of Human Services, and she sort of already discussed the dates and the plans for that. So I won't go over that too much with you. Mary Beth and I did talk, and we are locally going to set up a meeting for the two of us to meet and sort of talk about the ways in which our agencies already intersect, interact, and then, you know, just the ways in which we can continue to work together sort of as pre-planning for this merger and how we can best sort of plan for how this is going to happen. There's so much unknown yet, but working together and getting ahead of that is the best thing that we can think to do. There are some things I just thought I would share with you that we already have in place. For example, I have a worker who already sits at Lifeways, an eligibility worker, to help open Medicaid cases. She has a worker that sits at my offices and works with our children's services staff on mental health and getting assessments set up for mental health assessments. We work together in wraparound cases and SED waivers and just getting our staff together whenever possible and working to make sure that our joint clientele get the services that they need whenever we overlap. So when I started coming to these meetings, and every time I followed Mary Beth and did a presentation, I realized that we were talking about a lot of the same things. So when they started talking about this merger, it did make sense that, you know, the merger happened because we are doing a lot of the same things with our community. So there's more information in the report. I won't read that to you because I don't like to be read to, but if you have any questions about that, as I finish up, please feel free to go ahead and ask. Director Nick Lyon, who was the previous Community Health Director of Community Health, is going to be the director over the newly named Department of Health and Human Services. We at the Department of Human Services have been told we will not call it that until April 10th, but once it is effective, then we can sort of go to that new name. So we will start calling it that at that time. With regard to the Department of Human Services on a local level, and with regard to adult services, you will note in the report that I talked about what's happening with Jackson and Hillsdale counties. Our adult services program is no longer going to fall under my purview as the county director. It is going to move under what we call a different business service center. So it will have one supervisor for the two counties. Her name is Karen Rogers, and she will supervise the adult services workers. There were 2 in Hillsdale and 6 here in Jackson. So she will supervise all of them now in the 2 counties, and then she will report to someone at the Business Service Center who works in Oakland County. So it's part of our regionalization of adult services. The goal in doing this, and it may sound like this is not the goal because it doesn't have such immediate supervision, but the goal is that adult services is going to get adult services attention. So even though they don't have an immediate supervisor right here in Jackson or right in Hillsdale, they do have immediate adult services supervision and direction. So Business Service Center 6 is only adult services, whereas in my office, I have Jackson and Hillsdale, and I have food assistance and Medicaid and cash assistance and children's services, and at the time I had adult services. And so they wanted, adult services has sort of always been very small in nature and not getting the attention that it needed. And so they pulled it out and said, we want our elderly population to get a little bit more than it's gotten historically. And so that was what they did. We're just in the beginning process of this, so it's very, very early. I'll continue to sort of report on how things are going, but I will still be involved because we still have to have a community involvement. We're still going to be involved with Marcia as our community guardian. We're still going to be involved with all of the community agencies that are involved with the elderly population. It's just that administratively, they'll report up somewhere else. There's a typo. I apologize. I think it actually came from my last report. As noted in our last quarter, we have, and it says not placed a worker. It's supposed to say now. We have now placed a worker in the Office on Aging. So we do have an off-site worker in that office now, working full-time, doing eligibility and helping with that. And then I've also had attached to the report a list of our contracts that my board chair thought you may find interesting in terms of the contracts that the Department of Human Services, the state of Michigan, brings to the county. The column down at the bottom, total county contracts that you see is over $8 million, is over a 3 to 4 year period. Contract amount. The column all the way to the right is the 1 year amount. So that's the 1 year amount for those contracts. And we don't have a total down there at the bottom, but that's the 1 year amount. And those are all in the county here, money that we use to contract with the local agencies to provide services to the community. So we wanted to give that to you. And then with regard to our child care fund expenditures, we are on track. We are keeping close eye on that. the number of children that we have in foster care has remained pretty consistent, so we're able to stay within our budget, and that's always good news. We are continuing to work on looking at our residential placements, and we've talked with Judge LaFlamme and are continuing to meet on whether we can potentially have some of our residential placements that are 4E funded. I think we've talked about that in the past. And I have a meeting that we're scheduling for Friday, again, to continue some of that conversation. I also mentioned that there's been some discussion with regard to the possibility, our DHS office in Lansing is asking the county to take on the writing of checks. And in some counties, the county has taken on that responsibility. Right now, it's just a request being made, and at this point, my understanding is the County of Jackson is not interested in that. And I've sent that information back to Lansing, and as far as I'm concerned, that that answer is given, and hopefully we can just move on from that. But if there's any more conversation or any more questions, we're happy to discuss that. So,
Adam, would you like to, is there any additional information you'd like to offer when Zoe said the county's not interested in, would you please address that from the county's perspective and why, how that decision came to be?
Mike and I talked about it before the last DHS meeting, and at the last meeting, we discussed it at the DHS meeting. And then Mike and I discussed it again afterwards, and I think it's fair to say we were a little bit more open-minded afterwards, but still kind of failing to see a lack of interest on our part or a lack of reason why we would go through that. There is an expense to doing that, but we talked about after that meeting maybe the efficiency of the timing, how it might get resources to people quicker than going through the state. So it's, I don't know if it's fair to say it's closed. Mike may want to respond, but we talked before and after the last meeting.
The bottom line on it is, it costs the county money to do that. It's more checks to write, more paper to buy, more, more issuance. And so they've been doing it well, so we're like, well, why do we want to take that on? What is the reason? Would we incur additional costs given our budget situation?
Right.
That's really the question we posed back to the state. And the
Right.
only answer I've heard thus far is, we might be able to do it a little faster. I'm not so
Right.
sure, given this day and age.
and we'd like
of-
you to.
other than we'd like you to.
Yes.
But given this day and age of electronic transmission, I don't know that we can really write a check any faster than a state can write a
Right.
check. So I'm not sure it's really
What I have
faster.
heard, and I will tell you, this is just anecdotal, so no one has officially said this to me, is that eventually the check writing that the state is doing, that system, they're going to end, but I don't think there's a date set for that, and again, that's sort of just rumor that I've heard. And so my opinion would be, at the point that that happens, then that would be a different discussion. Exactly. And certainly with direct deposit and things of that nature, we'd be in a different place then as well. So they will, if they have a different, they'd be asking me at a different time then. So. The only other thing I wanted to mention is that April is Child Abuse Prevention Month. That's coming up, and I mentioned that at our Human Services Coordinating Alliance. Typically, we signify that in the world of child abuse neglect prevention with blue, the color blue, and we do that with blue pinwheels, and we also do that with a Wear Blue Day. And so we may be sending something out to request the agencies in the community to do potentially a Wear Blue Day for maybe, pay $2 to Wear Blue Day, and then hopefully all that money collected would then go to the Child Abuse Neglect Council for Jackson. And so that would be a way in which we can gather some money and do a donation. But I wanted to mention that because that's something that goes with DHS and is near and dear to our hearts, so. Other than that, if, I'm open for any questions if you have any.
Thank you. Commissioners? All right, seeing none, thank you, Zoe, for that report, and I would like to give DHS Chair, Mr. Brad Williams, the opportunity to address the board.
Good afternoon, guys. As we have the board, strictly, by the way, Zoe and Sandy, excellent, thank you. Very much a concern, but we're looking at it from a county perspective, as we are responsible to the residents of this community. And that has to do with that executive order. The executive order, the DHS director, Ms. Corrigan, she retired on the 31st of December. And the executive order went into effect around the 10th of February, and it will be finalized on April 10th. The only thing that could stop that executive order at this time is legislative action. We are requesting of our legislators that they take legislative action to stop that. And there's a reason why we're doing that. We're not saying that this is a bad idea or that the combining of services is a bad thing. What we're saying is this isn't properly vetted. I mean, if you listen to Zoe's speech or her little spiel, it was like, there's so much unknown. Well, what's wrong with this picture, guys? So we've sent a letter to both, to Mr. Senator Noss, Senator Shirkey, and Representative Pileski to derail this thing, to slow this thing down. Come on. There's so many changes that this is going to affect. I mean, what's going to happen to the boards? Are they going to be combined? The bottom line is Act 280 has no mention of the Department of Human Health and Human Services in it. It has to be completely rewritten. And that's just the act that we have to take and work under. What about mental health? What about your community action agency? What's going to happen to it? Mary Beth and Zoe, they don't know because it's up at a higher administrative level, they think. We're concerned. And I think you guys got something coming up. The MCA is coming up on the 31st of March, the 1st of April. It should be questioned by you. What are we doing? What is going on at this particular time? The way the child welfare, the automated child welfare system is working, why would we do anything at this particular time until they get that working? What about the sales tax, the no paperless sales tax system? It's not working. Let's slow this thing down. I mean, this thing is on a fast track, headed to, we don't have any idea where it's going. It's like pulling the trigger and then going to find out what the bullet, where it went. So I want to bring this up to you. I want you to know that that's our position.
All right.
We're maintaining that position. And we hope that somewhere along the line, you guys will get the wool out of your eyes and take a look at this thing.
Thank you for sharing your concerns with us.
Thank you.
Next on the agenda, the Health Department.
Good afternoon. My report obviously is in your packet, and I want to touch on a few things that I've identified some additional notes on. First page talks about essential local public health services and the funding reduction that has taken place as a result of that through the executive order. And I just wanted to share with you the loss in funding for us at the Health Department is right around $19,000 in this particular fiscal year. And I have communicated with Senator Shirkey, who is the Vice Chair of the Senate DCH Appropriations Committee, hoping that he will advocate on our behalf to restore this funding in 2016, because it's basically gone for this year. We haven't quite determined what the impact will be yet on service levels, but as soon as I understand that a little bit more, I will certainly share that back with all of you in my next report. Kids Count is a annual report that's prepared through the Michigan League for Public Policy, and it came out February 19, 2015. I've touched upon the good news and the not-so-good news, if you will, from that report in my report. And I guess the bottom line that I would share with you concerning Kids Count and the various health and social concerns that are identified in the report is that where we have put resources in place in Jackson County to address things like infant mortality and teen pregnancy, we have made a significant difference. That's actually in the report itself. You can probably see that on the second or third page. But fundamentally, I think what we need to do on a statewide basis, as well as a county basis, is figure out a better way of addressing poverty in the community. Because the extent to which we can address that, we will affect many health and social services issues on a widespread basis in Jackson County. So we need to keep working on it. You may be aware that the Health Improvement Organization, through the Community Collaboration Action Team, is working on pulling together a financial stability coordinating council here in Jackson County. The Health Department will certainly be a member of that. And it's just kind of getting into the development stage, if you will, and identifying all the potential members that will be part of it. But I'm hopeful that that will give us a community-based venue and forum to talk more about how we collaborate and coordinate in our efforts together to address poverty in the community. I would mention, too, that the May 1 ballot proposal actually does take us a step in the right direction if people are willing to support it, because it would restore the state earned income tax credit to 20% of the federal EITC through that funding mechanism. We were scheduled to meet with Deputy Director of Public Health Administration in February. Unfortunately, it got rescheduled to April, just letting you know that that happened, and I'll report back to you on our visit with her when that occurs. We have a lot of things in progress with Allegiance Health on health integration. I think that the provider survey on behavioral health diagnoses and the lead testing, screening, and EBL follow-up protocol, those will likely be finalized this month. It just takes us quite a bit of time to work through these processes. Influenza does seem to be ramping down now. I'm really pleased to say that. We are now in last time I saw a report, we were in a regional flu activity report, which is down from widespread. So the numbers I looked at this week are really ramping down, and I think with spring's arrival, we can probably put, hopefully, most influenza activity to rest. We did share in our report, in this report as well, the WIC breastfeeding peer counselor positions, which I understand is on your agenda this afternoon for courtesy information purposes. The Teen Outreach Program is extending a community invitation to a Talk Early, Talk Often workshop being held on March 19th at Northwest Middle School. And really, it's fundamentally about helping parents learn how to open the door of communication with a teen in their life and helping talk with them about sexuality and other things. So there is a flyer that I included in my packet as well for you for that information. Childhood Lead Poisoning Prevention Program, we've done an awful lot of work over the past couple of months on that. You can see on page 4, we had a partnership meeting with city staff. We looked into some future practices for further collaboration with the Lead Safe Home program. The Code Enforcement Lead Poisoning Assessment Dashboard is up and present on the Health Department's website, and encourage you to take a look at that if you're interested in knowing what other areas we can improve on with the city's efforts. Joint supportive actions for damaged properties. We're working directly with the city manager on that. As you're probably aware, 151 building downtown suffered some water damage earlier this winter, I believe, and we're planning to go through and take a look at that and communicate with the owners of the building, because I know that the city is very interested in preserving that structure and wanting to see it move forward for another purpose in the future. We had a follow-up meeting with the Jackson Area Landlord Association on February 23rd. That went well. We work with all the landlords, but this is a venue for us to talk with them specifically more about lead poisoning prevention. Karen Spidell from the MDCH Lead Safe Home program came down, and it was a very, I think, positive meeting. We got some follow-up to do from it, but we're working with the city on that as well. Safetyville update, I updated you back in probably December, January timeframe that was successfully concluded. We actually had the evaluations from the program data to share with you, so I put that in the chart on page 5, and you can see that is very strongly supported and met people's expectations. Finally, over on page 6, very positive information from my perspective is that the on-site wastewater permits have increased significantly now in the community since 2007. We had 176 permits issued in 2014, and that's a significant increase, so we're optimistic that perhaps we really have transitioned out of the economic slump we've been in since 2008, and we'll see more activity taking place in the future. The only other item I have, I think I'd touch on briefly, would be under animal shelter recruitment. We have a lot of challenge sometimes trying to find people to fill kennel attendant positions. My report indicates we had interviews and review of past applications. We've actually filled that position now, so all the positions at the animal shelter are currently filled. Good news. And I take any questions you might have.
Commissioners? All right. Seeing none, thank you, Richard,
You're
for
welcome.
that monthly report. Next on the agenda, we have an item that was visited at 10 o'clock at the Personnel and Finance Department. So I believe that, or Personnel and Finance Committee, I believe that issue has been discussed and vetted, unless we have any additional information or questions, comments that anyone would like to make. I don't.
It's informational for this group.
Correct. Thank you. Thank you. So with that, we will move on to letter H. The Health Department, Region 1, Local Public Health Mutual Aid Agreement. In front of us, we have the request. Let's see, letter H, Carrie? We there? That's okay. I moved too quickly. She wanted to go back to letter G, didn't you, Carrie Ann? Yeah.
You, huh? Okay.
Yes, we were kidding. I wouldn't let you. All right, so I understand under letter H, we are looking to approve this agreement, Resolution 3-15.9, to authorize entering into a Region 1 Local Public Health Mutual Aid Agreement. Richard, is there any information you'd like to share with us that's not in the document here, or any
Well, I think I
summary?
probably have pretty well covered it. We have been in this mutual aid agreement since 2006, and so this is kind of a review and a revision, modified slightly language here and there, nothing of real significance. There's been a lot of turnover, obviously, in health officers over the past, well, I guess 8 years, if you will, that this mutual aid agreement has been in place, and so it was time to refresh it and have our new board chair sign as well.
If there are no other questions or comments for Richard, I'd be willing to entertain a motion to move this to the full board. We have a motion and support. All in favor, say aye. Opposed, the same. All right, this will move on to the full board then. Thank you, Richard, for all
Thank you
that
very much.
information. Under old business, we have the February claims. We have a motion and support to pay the February claims. All in favor, say aye. Aye. Opposed, the same. Motion passed. Other meeting minutes? As there are none in our docket, we will look at April reporting schedule. And at that time, we will have individuals reporting for us in April. Thank you. Public comment? Is there any public comment at this time? Seeing none, any committee member comment? Seeing none, we adjourn to the call of the chair.